It is now my great pleasure to introduce Shannon Rudisil, Associate Director of the Child Care Bureau in the Administration for Children and Families at the U.S. Department of Health and Human Services. Shannon?
Thank you so much. I just want to thank the Women's Economic Security Campaign for having me on today. This is obviously a topic that is near and dear to my heart. I have to say that it's for more than one reason, because I do run the Child Care Bureau, which is sort of our national home for child care in the federal government. We administer the Child Care and Development Block Grant funds that were referred to earlier, also known as the Child Care and Development Fund. But I am also a working parent of 2 small children, and I have to say that I am in the midst of a child care crisis myself. I was very on edge over the weekend. And, you know, one thing that I did try my best to stay focused on was the fact that we have 2 parents in our family. We both have relatively flexible jobs, and we have the luxury to sometimes throw money at this problem and even double pay people to be sure we have backup and flexibility. And, you know, over the weekend as I was stressing out, I just kept going back over and over again to all the advantages that I have to try to handle this that some other mothers do not. And I know that those are the folks that those of you who are working on this campaign are really standing up on behalf of. And, you know, I just really appreciate the work that you're doing and putting a spotlight on it, especially for folks who are kind of struggling sometimes on their own to figure this out. So you'll notice that I've titled this Pathways and Partnerships for Child Care Excellence. That is what we are calling our work plan in the National Child Care Bureau. And I'll say something about why we have titled it, why the pathways was really resonant for us. I think it goes to some of what you heard in the earlier segment. You know, there are over 100,000 licensed child care centers. There are over 200,000 licensed family child care homes. And there are many more unlicensed providers who do good work every day, you know, relatives, grandmas, and others taking care of children. Even just in the CCDF, the federal subsidy program, we fund 600,000 providers a year. And we have a wide variety of quality of professional development and professional preparation of the workforce. And the Pathways image is really resonant for us because it speaks to meeting people where they are and meeting programs where they are and providing them support and assistance in the form of financial assistance and sometimes non-financial support like training or technical assistance to really move forward in doing a better job in taking care of the nation's children. So that's why the Pathways image really speaks to us. Next slide, please. The work that we do in the Child Care Bureau really falls under a rubric of some national developments on early care and education, and I think I should go through those quickly. I mean, first of all, we're really working under a national early childhood systems framework, so I'm going to do a slide on what that means, how we're working across Head Start, early Head Start, which was mentioned, as well as education to try to figure this out, how we build a system of early care and education. Money was mentioned, and I want to talk a little bit about the Recovery Act investments in early care and education and the President's budget, and then I'll talk a little bit more about our pathways to excellence. Next slide, please. The National Early Childhood Systems Framework that I want to talk about consists of a couple of things that have happened recently. The Early Learning Challenge Fund was considered in the Congress over the winter and was in the President's budget. The idea that we would look at a system of quality improvement into the quality rating improvement systems and workforce systems that were mentioned in the WESC report. We did not have the initial success that we hoped due to some challenges with funding in Congress, but it's very much on the table and worth mentioning because it provides a vision for how we can put a system around all of this varied child care market that we have in the country to move forward. We're still very hopeful about it, and I can say the administration is still committed to realizing this vision. The other thing that's going on is early childhood advisory councils, which were funded. They were in the Head Start Act authorized and then funded by the American Recovery and Reinvestment Act. And money has gone out to 45 states. 5 states declined to apply, to have state early childhood advisory councils as governing bodies that look across all of what's going on for young children in the state regarding Head Start, early Head Start, child care, perhaps home visiting programs, and a number of other early childhood approaches for young children. And I would encourage people to find out what's going on with those councils in their states. And finally here, we've been engaged at the U.S. Department of Health and Human Services with the U.S. Department of Education, also the Labor Department and the Agriculture Department, in an early learning initiative for the past year where we formed study groups to look at issues around program standards, the early childhood workforce, data around child care and especially the workforce. Also, we had some work going on health and nutrition. So our study group spent a year coming up with ideas of what an ideal system would look like. It's been really quite a process, and it was great to bring language together across the departments in order to do that. That culminated in a conference that we had in August, our Early Childhood 2010 conference, that brought together child welfare, early care and education, mental health, folks from Department of Agriculture and Labor to really look at the way we could move forward together on this. And at that conference, one of the things that was announced was an interdepartmental policy board across ED and HHS to really look at the ways that federal policy could assist states and local communities in putting together early childhood policies. Next slide, please. So now I'm going to shift a little bit from talking about the sort of broad framework that we're working in at the federal government to talk about money. So as Inger mentioned, the Recovery Act was a great shot in the arm exactly, I think, when parents and the economy needed it for early learning. There was $2 billion in the Child Care and Development Fund. We estimate right now that that's going to serve over 200,000 children who would not have otherwise been served with child care subsidy. Many states eliminated waiting lists, reduced waiting lists, raised their eligibility levels from what they had previously been. States have spent that money at a variety of paces. Some are almost out of that money. Others still have money to spend in 2011. They had to make hard choices about how quickly to spend the money versus making it more sustainable over time and serving fewer children for a longer period. The other thing I would note is all states made some quality improvements with the funds, but 35 states really looked at the kinds of systems that WESC is recommending in the report. So either a quality rating improvement system or a workforce or professional development system like a career ladder for workers or a scholarship program. And I would just also say in terms of the economy, the thing that really struck me was the way that states' actions reflected what was going on in the economy. For example, I think almost 15 states instituted eligibility for child care help during a job search period, which really goes to show that states are sensitive to the fact that workers need stable child care in order to maintain employment and progress in employment, even when there's a little bit of a hiccup in their employment. We don't want them losing child care and then going to the back of a line, which, or, on the back of a waiting list, which would undermine their long-term ability to stabilize their family's economic situation. It's also worth noting that there was a large expansion of Head Start and Early Head Start, adding about 10,000 preschoolers and about 50,000 infants and toddlers. That's why it's so important that, as I mentioned in the earlier slide, that we work together with Head Start and Early Head Start, because if we do that, we can maximize the number of high-quality, full-day, full-year slots, spaces that are available for families. Next slide, please. So I just want to point out that the President's budget for 2011 would sustain and actually increase the ARA investment, $1.6 billion for CCDF, which is the Child Care Subsidy Funds and Quality Improvement Funds. That would not only sustain ARA, but take it up by $600 million a year, hopefully in anticipation of a reauthorization. Also, the Head Start investments were largely sustained, and the Challenge Fund, as I mentioned, we don't, at this point, it's unclear whether or not these budget requests would be granted. It's a hard time. You all are reading the newspaper. Money is very tight on the Hill, but it was the President's intention that the Recovery Act investments be sustained for children and families in early learning and care.